Hello,
Hello.
this is Jean Amoy. Welcome to this interview. Can you please present yourself to the audience?
Yes, thank you, Jean D'Amour. This is Aimee, the community health advocate at Vibrant Valley Patient Centered Medical Home. And I am really happy to be with you in this interview or in this presentation so that we can talk more about different questions.
Yeah, thank you. Global health seems to be in the news more and more in recent years. Talk about what global health is and why it's important to pay attention to it.
Thank you for the question. Basically, global health is defined as an area of study which is designed to prevent diseases all over the world by promoting physical and mental health through organized communities to make a healthy world. I can give you an example of global health, what it actually do. Usually, sometimes do. For instance, a syndromic surveillance, where a research is conducted to detect any if there is any symptoms of a disease which can can kill people like Ebola. Some tests can be done ahead of time in order to evaluate if it is going to affect people. So that's what global health in short is, and it's really important to pay attention to it because it deals with to the improvement of health of the public around the world. So people should pay attention to it by giving real information about any diseases so that uh, global health can be improved around the world. So thank you.
Where disease can come to us in different ways. Explain the difference between communicable and non-communicable disease.
Yes, thank you for the question. Communicable diseases are the ones which are contagious, like which are transmitted easily from a person to another. Um, Actually, they are sometimes they are caused by bacteria and viruses which pass through air, so they are really transmitted faster among people. So an example of it is can be malaria, tuberculosis, diarrhea, dysentery, and others. So the non-communicable diseases are the ones that are not transmissible from a person to another. So they are mainly caused by changing lifestyle like alcohol abuse, poor diet, for instance, cancer, which is caused by for instance, poor diet, lifestyle, and even stroke, hypertension. Those diseases are not communicable, but they are non-communicable because they cannot be transmitted from a person to another. Thank you for the question.
Yeah, you've been talking about Ebola. Let's talk about Ebola. Since I'm sure most of our viewers have heard a lot about that. What is it? Is it communicable, non-communicable? How do people get it?
Thank you. Actually, Ebola is a communicable disease because people get transmitted one to another. In case I am affected with it, I can easily transmit it to you via like the fruits, the water. I can use my sweat can really affect you, but you to be affected with it. So it's communicable diseases and it is transmitted via those fluid, air, any attachment of a person who is affected can really cause another one to be affected by it. Also, it is also transmitted from primate to human, including gorilla and chimpanzee. If a gorilla is affected by Ebola and attached to it or attached its fluid or blood, I can get affected with it. So, thank you.
Um, what would raise a person's risk of getting Ebola?
Oh, thank you. Actually, something which can raise a person risk to get Ebola, it includes being in touch with a person sick with Ebola through broken skin or mucus membrane. For instance, noise. You know that there are mucus in the nose, so if you touch the noise in case there are mucus, you can get affected. and even the mouth because there are some saliva. So that's how that can raise a risk of getting Ebola. Also, having having a direct contact with blood or body fluid or item that come into contact with blood or body fluid from a person with Ebola, and also touching bats or non-human primates such as apes or monkeys, or blood, fruit, or raw meat prepared from these animals. Those can raise the risk of getting or being affected with Ebola. Also, to go into hospitals where Ebola patients were being treated and had close contact with the patient. That also can raise a risk of getting Ebola. Also, touching the body of a person who died with Ebola. So, thank you.
Oh, great. So to prevent or at least lessen the chance of getting Ebola, what should people do?
So, thank you for the question. People should avoid the causes of Ebola by not holding items that may have come in contact with an infected person's blood. For instance, if I know that a person touched a cup, in case he is affected with Ebola, I cannot touch it in order to prevent being affected with it. Also, to avoid funeral or burial rituals that require handling the body of someone who has died from Ebola. And also avoiding touching a deceased person who died from of Ebola uh, can can reduce the or prevent to be affected with Ebola. Also to avoid contact with bats and non-human primates or blood fluids and raw meat prepared from these animals. Also to avoid contact with semen from a man who had Ebola until Ebola is gone from the semen. Yeah, that's about how we could prevent its transmission.
Well, outbreaks such as the one related to Ebola can generate a lot of rumors and misinformation and even panic about what the disease is, how it is transmitted, and how likely people are to get it. Talk
Yes.
about the need for educating people about facts versus myths.
So thank you for the question. Actually, people should be educated to provide factual information rather than spreading myths, because it's really benefits global health, or it's improve global health to get factual information rather than getting myths. I can give you an example where in DRC Ebola outbreak, then people start saying that even like if a person reach a place there, even a minute, he or she can get affected with Ebola without doing even anything. So that was a need. In that time, doctors can feel like it's very serious, which is different on how they know it. So people should really provide factual information in order to help those health providers in order to get accurate data instead of spreading rumors. So thank you so much.
Um, how about the complications that Ebola raises from the rights of travelers and the responsibility of governments?
Yes,
Kachi Hitchcock's,
yes,
for example, a nurse from mine who returned to the States following a trip to West Africa in the
mm-hmm.
fall of 2014
Yes,
promptly had quarantine-related restrictions thrown up on her.
mm-hmm.
Restrictions that she was very much against briefly described the difficulty of balancing individual rights and government responsibility.
Yes, thank you so much for the question. The government has a right of dealing with the improvement of health, and also but people also have the right to travel, like their rights is everyone has the right to travel. So in case of fighting against those diseases, it's how something difficult comes. Taking an example on this woman called Hickson. So He went to treat Ebola patient in Sierra Leone. Then when he came back in USA, she have been arrested in a tent because the government thought that he is really affected with Ebola. But fortunately, they found that she's okay. She's okay for it. She's okay that she's not affected. So in that time, I can say that on my point of view, the government was right to examine if she had Ebola in order to prevent the spread of that diseases, which we really could really prevent other people dying with Ebola. So I can conclude that the government has that right of checking if she is affected in order to prevent others from being affected. And also, this woman, this girl, had a right to travel to other countries. So, so that's how right and governmental responsibility can be fulfilled without ignoring one's right or one's responsibility.
Great. Let's talk about smoking and tobacco use, which
Yes,
is considered a big world health problem and raises similar issues to Ebola in terms of rights and responsibilities.
yes.
Just about everyone knows that smoking harms health. What does it what does it do to the body?
So thank you so much. Actually, smoking is very dangerous to the body because it's damages about every human organ. In fact, 16 million of Americans live with a disease caused by smoking. Unfortunately, each person of them dies because he or she used to smoke and no less than 30 people live with illness that are associated with smoking. But then some of the diseases caused by smoking include cancer, heart attack, lungs, and COPD, known as the chronic obstructive pulmonary diseases. So actually, smoking destroys the organs and start causing people to suffer from these diseases. So smoking increases the risk of being affected with tuberculosis, eyes diseases, and immune system problems. So you can imagine how smoking contributes to COPD, a disease called chronic obstructive pulmonary diseases. According to Centers for Disease Control and Prevention, when children or teenagers smoke, at their ages that affect their lungs to grow slowly and delay to develop. Unfortunately, this increase the likelihood of being at risk of developing chronic obstructive pulmonary diseases. So during their when they become adults, that's when they start getting sick of COPD because they have smokes. You can see that it's very dangerous to the body. Yeah,
It's very dangerous.
yeah.
What about secondhand smoke?
So
Explain that and what is that and how it affects people.
thank you so much. Actually, second-hand smoke is when a person breathe or smokes fumes from a person who is smoking by near him or her. It's very dangerous, more than even smoking, because it affects people badly as it contains more than 7,000 chemicals and some 100 are toxic and about 70 of them cause cancer. So, since in 1964, Surgeon General's reports about 2.5 million adults who were non-smokers died because they breathed second smoke. Actually, it is really dangerous more than smoking. The diseases most it causes include stroke, coronary heart diseases, and lung cancer. Sadly, it contributes to around 41,000 deaths among non-smoking adults and 400 deaths in infants every year. And it increases the risk to children of being affected with asthma, infections in their lungs, ear diseases, and others. So it's very, very dangerous, and it's all about breathing other smokes or fumes when they consume tobacco use. So thank you.
No, great. Um, People don't typically think of tobacco as a drug like heroin or cocaine, but
Yes.
the addiction it creates is strong,
Yeah.
isn't it?
Yeah.
Should we think of tobacco use as a form of substance abuse?
Yes, I do. I strongly agree that tobacco use is a form of substance abuse due to the fact that it's composed of a chemical component known as nicotine. Basically, smoking harm almost all human body parts. That's why tobacco use is an abusive substance. According to National Institute on Drug Abuse, people who smoke are at risk of being affected with cancer, as at least 69 chemicals in smoking tobacco are carcinogenic, like cancer causing. The chemicals which compose tobacco are carcinogenic to mean that they can cause cancer. They are cancer causing. They are the causes of cancer. Hence, cigarettes smoking accounts for about 30% of all deaths caused by cancer and other respiratory diseases as well. So, thank you for the question.
Yeah, thank you for talking to us.
Yeah, thank you too.